American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ASAP, I depoliticized it. The Congress has been investigating ASAP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
And maybe you're listening to a selective group of people.
Well, you get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
I got 30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that
the position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest, and we depoliticized it and put great scientists on it from a very diverse group. Let me close pro-vaccine.
Let me close with this, because like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I get a reply? Or, Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman in this committee, put together on a bipartisan basis.
All right, we're going to proceed. And I just want the rest of the members to know, I gave Senator Wyden as ranking member some leeway there, but we're going to stick to the 5 minutes. Senator Grassley.
First of all, thank you. I have asked HH secretaries in the past to fully utilize the Rural Community Hospital Demonstration Program under Medicare. The program has been underutilized. In May, the CMS filled the open slots. Thanks to your agency's work, there's been 10 more rural hospitals in the program. It's important that the federal government uses every tool possible. to help rural hospitals, and thank you for making that possible. Now to my questions. Back in January, during your confirmation hearing, you told me that you agreed to leave farming regulations to the Department of Agriculture and EPA. Do you think that any comments you have made since your confirmation on topics dealing with agriculture are consistent with what you said in January, that USDA and EPA ought to be regulating farming, and that the Department of Health and Human Services should not seek to regulate farms, the tools they use, or the markets that they sell into?
Yes, Senator, we are working very, very closely with Brooke Rollins and with the agricultural community. We've met with over 140 farm interests over the past 3 months to incorporate them to make sure that the MAHA agenda is consistent with their agenda. We are producing the best food in America, that we're protecting our soils and our soil microbiome, and that we're protecting all kinds of farmers, including those who want to transition to regenerative agriculture. We're consulting every stakeholder in the farm community in everything that we do.
I just raised the question because farmers in my state have been concerned about some of the things you're saying.
Senator, I can't hear you.
I'm sorry. Some of the farmers in my state have been raising questions about some of the things that they think you said, whether it was out of context or not. I just thought I'd raise this question so that you would keep by what you told us back in January at your confirmation hearing. Now, Senator Durbin and I have a bipartisan bill that requires price disclosures on TV ads. Price transparency is important in drug advertisement. I know that President Trump, Vice President Vance, and you are all supportive of this effort. When can I expect action from this administration on requiring drug companies to publish the price of drugs in their TV ads? And just in case you would tell me that you don't think you have that authority, can you help Senator Durbin and I on our bill so that we can ensure that you have legal authority to require price disclosure?
Senator, I think it would be good for us to talk about this offline. We are working on this in our agency, and I'm happy to give you the details of what we're doing.
Okay. I got a question here on transplant. Senator Kennedy and I have been working, or Senator Wyden and I have been working on this. For nearly 2 decades, I've engaged in a bipartisan oversight of the organ transplant system. RISA has developed a tool to combat transplant line skipping. I hope that you can take steps to make sure that these steps are being taken by HHS and ERISA to curb transplant line skipping. On July the 2nd, Senator Wyden and I wrote you a letter highlighting cases of OPOs in Mississippi and Kentucky. In each of these cases, OPO allegedly tried to harvest organs from patients still showing signs of life. I expect you to take steps through these organizations to ensure that this doesn't happen again.
We have mounted a major investigation of misconduct, of illegal behavior, of organ harvesting, of living people, of line skipping, of favoritism, of all kinds of scandalous behavior inside the organ procurement organizations. We have already ended the contract, terminated the contract with the sole source provider. We are reorganizing the entire industry so that this can never happen again. I'm happy to go into the details with you if I had more time.
Thank you. Senator Cornyn.
Mr. Secretary, the United States spends approximately 18% of our GDP on health care, and yet by most accounts, we rank roughly 10th in the world in terms of health care outcomes. Our Democratic colleagues seem to think the more money you spend, you're necessarily going to improve those outcomes. But at the same time, we have the two major drivers of our national debt, Social Security and Medicare, while we spend more money on interest on the national debt than we do on defense of the nation, which is an unsustainable trajectory. What is it that you're doing to address the effectiveness and the outcomes of our health care expenditures as opposed to just throwing more money at the problem?
Yeah, I mean, throwing money at the problem does not work. We spend 2 to 3 times per capita what European nations spend on health care, and we have the worst health outcomes. We're 79th in health outcomes globally. Over the past 20 years, we've lost, or 30 years, we've lost 6 years to Europe in terms of longevity. So our lifespan was even with Europe's, now it's 6 years behind. As I remarked to Chairman Wyden this morning, or Minority Leader Biden, today we got new data that showed that infant mortality has increased in this country in 2024 for the first time in 20 years. Diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC, but also we've already righted the ship at NIH, at FDA, at CMS. And we are going to end the chronic disease epidemic. We are devoting thousands of studies. We're going to devote to identifying the causes, and we're eliminating them. And we're already starting. We're not waiting for everything to come in. We are starting now. We're doing this with food dyes, with grass standards, with dietary guidelines. We're going to get better food and better health to the American public because it's chronic disease that is bankrupting us and destroying our national security.
It seems to me one of the biggest problems that we have in America today is the trustworthiness of the information that we actually receive from the news media and from any other source. And obviously, the easiest thing for our Democratic colleagues to do is to scare people because that is a powerful emotion, no matter what the facts may be. Do you believe COVID-19 was politicized?
Yeah, the whole process was politicized. Senator, I mean, we were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they'd prevent infection. It wasn't true. They knew it from the start it wasn't true because that's what the animal studies and the clinical trials showed. We were told that there was science behind cloth masks. The CDC allowed the teachers union to write the order closing our schools, which hurt working people all over the country, and then pretend it was science-based. All of these issues, and then I can show you, like, for example, Chairman Wyden was talking about me politicizing ACIP, but during COVID, probably the most famous scientist on ACIP was Martin Kulldorff from Harvard, the great world-renowned epidemiologist and vaccinologist. And he criticized the COVID booster mandates. They ejected him from COVID because he wasn't in the orthodoxy. The two biggest health officials at FDA during COVID, Dr. Gruber and Dr. Krause, criticized the Biden mandates, vaccine mandates. President Biden said in August, I would never take that vaccine, the Trump vaccine. And he came in, he mandated it, and then he fired the 2 top health officials at FDA who said, hey, this thing has not been properly tested. So the whole process was politicized, and even today.
So let me, in 15 seconds, so I think you answered yes. It was
Yes.
politicized. And I have concerns that when you look at some of the conflicts of interest in peer-reviewed articles in professional journals, and when you point out that even some of the physician associations are conflicted because of the money they get from the pharmaceutical industry, are you committed to trying to make sure that we use the best science and separate and eliminate politics as much as possible?
That is what my job is. That's what my mission is. Eliminate the politics from science.